some tips on how to be one of the best medics, corpsmen, any medical person in the military right here. What is up, guys? You're tuning in to Nikki MGTV for another military video for all your military video needs. As always, you can hit me up on Instagram, Snapchat, or down in the comments below if you have questions. But as always, let's roll right to the topic, and that is how to be the best corpsman, the best medic. I feel like this should apply to both Navy and Army side. If you are going to be a corpsman, I think this is going to be very essential to understand your role as a healthcare provider. Even though you're not the doctor, you're not the nurse, you're not a PA, you're not any of those things, you have a totally vital role, and I want to kind of talk about that here. I'm kind of starting at the basics with this, but I want you guys to understand you should keep one thing in mind at any moment as a corpsman, as a medical provider, and that is patients first. No matter what, do not put off patient care for a personal endeavor, you know, or some kind of paperwork when someone is there in front of you. I feel like a lot of people can kind of get blinded by that aspect, and they're not really focusing on that because we get caught up in kind of like the sensors don't go off, and that one time that you could possibly bump somebody away and say, hey, can you come back later, or whatever the case may be, that could be the person that really does need treatment. Always lay eyes on your patient, always find out what's going on, because trust me, that one time you do, it's gonna cover your butt. I've actually had one of those cases recently where I was like, I think this guy, I saw the guy's name and I was like, this guy's probably not gonna be really sick, but I'll see him anyway. And I saw him and I was just like, man, sure enough, this guy was sick. So it's a good thing I actually did take a look at him, really good. And you hear a lot of stories from other people that have been in healthcare that they're like, man, there's some people that come in just for every little thing, but do not take that lightly. As are people too. You want to make sure that you're treating them like that. This is very much a customer service role. Next one is going to be own the situation like you own it. And a lot of people that are in medicine will understand this. Definitely understand that there's always a first time for everything, but you always own the situation, act like you've done it a million times. So for example, if you're cutting into somebody for whatever reason, or you're doing some kind of suture and they ask you, hey man, is this your first time doing this? Do not ever say that you have only done this once or you're just now doing it. Here's the next thing. Do not Google anything in front of your patients. And there's actually been some flack from people that think that a lot of doctors are just Googling answers, right? And so they think, oh, if you just Google answers, then I can Google on WebMD and bam, I can get my diagnosis. Just want to give you a heads up, if you're not in medical, do not do that. I promise you, a lot of people that are not medical don't understand how to filter results or what they're trying to look for. You usually end up going far right, far left, from what actually the problem could be. And yes, there is a time and place for looking at references. A lot of times medical providers, doctors and stuff like that will actually go to UpToDate or some other kind of web-based application that you can use in order to find information, because usually as a medical provider, you have to realize a general practitioner such as an IDC, PA, nurse practitioner, things like that, you're not going to have every single answer. It's okay to realize that, but don't do it in front of the patient. If you're a patient person watching this, realize there is a specialty for every aspect of medical care: internal medicine, cardiology, respiratory, audiology, optometry, optician, pharmacy, pediatrics, GI docs, general surgery. I mean, the list just goes on and on and on. And so I understand a lot of people place faith and trust in a lot of their general practitioners like myself, but realize a lot of times we're kind of looking for red flags to filter stuff in, filter stuff out, to make it the best diagnosis that we possibly can with the skill set that we have. And we have a very good generalized understanding of what to maybe kick to the next echelon of care as far as specialist or something like that. Next is earn the trust from your patients and also sell your medicine. A lot of times you're gonna have patients that don't believe in what you want the plan to be. So for example, a lot of times we talk about lower back pain with a lot of patients, and sometimes you have that patient that doesn't stretch at all, They don't really actually do what they're supposed to as far as exercises. They're not taking their medications. They're just kind of hoping things get better without actually doing anything. This is a time that's important to sell that to them, because a lot of times people are not going to believe you. And then you're going to have that one that actually tries it and they're like, man, that actually worked. Doing yoga or doing some kind of stretch actually helped me out. I don't have back pain anymore. You have to sell it. And it's hard to do that to somebody because we're in a society where a lot of it is now. How can I get fixed now? And your body doesn't work like that. It can take days, weeks to heal even a simple rolled ankle, things like that. This next one is to be truthful in your interactions with your patients, even if it means not really being able to be nice about it. I want to say this as a medical professional, there's sometimes where you're going to have to talk about factors that may contribute to someone not having the best healthcare. Best example I can get is a lot of times people that have increased in weight or maybe gained weight recently can have more knee pain. So it's key to realize if somebody is going through that and you notice that they've gained weight, maybe on their vitals or height and weight or whatnot, you can see that they have gained weight, and you're gonna have to maybe have that talk with them. Hey, there's a dietitian, there's someone else that you can see. Don't just say, hey, you're a big guy, you know. If there is some kind of problem going on that you need to be honest, also be able to give the answers in regard to what solutions they can go to, and make sure it's more than one, because I think if you were in that position, it would be uncomfortable at certain times. And that's kind of how medicine can be, because there's all parts of the body which can be taboo, and people are already nervous about coming in anyway. This one is key, which I think a lot of corpsmen and medics probably don't do a lot of, but I think is essential, and that is keeping up your education, your knowledge, your whatever you can to keep your skills refined. I feel like a lot of people don't really do that, because when you're in your day in, day out job, it's very easy to get stuck just doing the basic necessity of what's required of your job. Whereas a lot of times as a medic or corpsman, you're going to be out in these isolated areas, possibly by yourself. So imagine a combat situation where you're not going to have a doctor, a PA, or somebody like that to go reference to. You're going to fall back on the skills that you had back at your home base or previous training and stuff like that. So you can't really just wing it. So this next one I want to say is take care of yourself. A lot of corpsmen, medical, just in general, we can get so wrapped up in the stress and the grind and trying to treat every person possible that you're going to have to take time for yourself. This next one is prepare for the worst. And I say that because a lot of people don't realize when I say this, and it's totally honest, you never get to pick your patients. When I come in any single day that I'm there, I don't get to pick my patients, but I realize I need to be ready for anything, and that is going to be difficult. And that could be on a battlefield or in a clinic or wherever. So imagine you have to carry one guy from one street to the next. A clinic where it's something you really don't like doing. For some reason, people don't like doing toenails, like myself, ripping them out. I hate doing ingrown toenails, but I have to do them because it's part of my job. So realize you do not get to pick your patients. The last thing on this list is, I think, key, and it sucks to admit it, and you're gonna make a mistake. And that's just, as a medical provider, you're not perfect, you're human. You wanna hit all the wickets, and it's hard. It really is, because there's always times where you're gonna look back at what you could have done better, what could have went more smoothly, if you would have planned this or planned that. It's hard not to be a perfectionist in medicine. It also comes with the expertise of being able to make sure that you are constantly learning and realize that what you're doing is the best for your patient. I think that's a very good thing to realize, and your intentions are always, or should always, be good, but realize there are going to be times where maybe that doesn't come across, and maybe your patient doesn't like you, or something like that. And I've had times like that with myself where I thought I did everything I could and the patient still wasn't happy, or maybe the patient's outcome didn't come out how I wanted. I think that that's very hard to carry with yourself, but realize, take that moment, take it as a learning lesson, and then you're gonna have to move on to the next one, and don't really beat yourself up over it. But if you have been a corpsman, are a corpsman, 68 Whiskey medic, whatever you want to call it, if I miss anything from this video, make sure you put it down in the comments below, because I think there's more wisdom to share with many years of experience that are around the entire fleet of the Navy and Marine Corps and also the Army. So just put it down there, let these other future people know what to expect, or maybe get some little knowledge from you guys. But if you do have questions about the military, you can always hit me up on Instagram, Snapchat, or down in the comments below. I love you guys. I'll see you next time.